Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. You know, the weekly updates seem to come faster and faster these days. Now, if you've been paying attention, or if you've been keeping up with these videos, then you know my buddy here went topsy-turvy weeks ago, vowing not to return to right side up until the surge of infections came down. Well, he's still upside down, not yet convinced it's quite time yet. But there is some data here, at least hopeful, and certainly compared to last week. So please share this with someone you care about. For the United States, the country remains largely in the red zone, but hey, noticing a bit more orange on the map this week. Not for Alaska, though, the new hotspot. Alaska now the highest rate and going up day by day. But right now, it's the only state greater than 100 per 100,000 population new daily case rates on a 7-day rolling average. And while others we have seen be super high, they're way down too. For example, take Florida. A few weeks ago, they were at 150 per 100,000 population. This week, at 40. And look here, the curve of new cases for the country definitely looks like a peak has been passed. Our neighbors, each still with really high levels, but each one lower. And how long has it been since we could say that? Tennessee and South Carolina well down from their numbers last week. But for both, every county still in the red. Georgia now with quite a few counties in the orange. For North Carolina, down as well now, and all but one county, however, still in the red. Cases and hospitalizations, although remain high, both are down a bit. Deaths, however, remain high. But then deaths lag cases and hospitalizations. For Western North Carolina, every county, every one, down this week, except for Transylvania, with only a small uptick. And those who were really high before, some are down, and some of those seeing rates reduced by half over this last week. As far as testing, not much change for anyone, but do note now the state, Graham County, and Buncombe, all under 10%. For Haywood County, total cases for the pandemic are at 6,677. This represents an increase of 294, down from last week's increase. But note, we still continue to track at a faster rate of increase than even the exponential line. And although down compared to last week, it should be noted that there was a marked daily increase in the daily numbers the last couple of days of the week. We were seeing more than 50 new cases a day on Thursday and Friday. That would equate to a number of 83 per 100,000 population. And notice we remain at or above January's peak, and we've been here for a longer time than in January. More than 80% of new cases in the county are those not vaccinated. Nearly all the hospitalizations and deaths are those not vaccinated. And speaking of deaths, one additional added this week, now at 128 in the county for the pandemic, and that's the largest monthly number now since January. Haywood Regional Medical Center with fewer COVID-related admissions at week's end, about 14 average and 14 total at week's end, one of whom in the ICU on event. Both of those numbers are improved. So, as you can see here, we have disconnected from the experience in the UK. We are now on our own path. So unable to get any real guidance about our direction from that. It's possible that we have seen our peak. Every Western North Carolina county is down, except one. They were really flat. Other areas of the country, previously really high, now substantially down. Although other places that were not so affected earlier are now substantially up. But this may be a brief lull as the weather changes, we move indoors, and with so many of us not being careful enough in the face of a more contagious strain. And that's why my buddy here remains unconvinced. So we'll see. This week, both of us are going to pay close attention to whether the trend continues or heads back up. We're certainly a little better than last week. Will we stay there is the question. So be well and be careful, especially right now.